Welcome back to West Texas View.
Before the break, Christina Granada was telling us about her job as the administrator and community action person for the Laura Bush Institute, which is under the auspices of the Texas Tech University Health Science Center. And so I want us to talk a little bit about your Lunch and Learn program.
That program was started by Dr. Leslie Chubb. And basically what it is we put on a brown bag lecture series through the lunch hour at Midland College.
For all ages.
For all ages, of course. We do, get a lot of the college crowd there. But that's good. We want to let them know how important this is too. And we've done this for now 2 years that I've been a part of it. And what we do is we just go out there and present on different topics. Sometimes Dr. Chupp will give the lectures. Oftentimes we'll try to find somebody outside of the community that services, women's health as well, and let them come in and do a lecture for us. We've had alcoholism, we've done robotic surgery, different things of that nature. And so it's just kind of an opportunity for us to present some information, and that's part of our community outreach within the Laura Bush Institute.
And sometimes these topics are chosen by the people themselves that come to the Lunch and Learn. They'll say, why don't you have a program on this? And so you work that into the...
We do. We talk with whomever we're presenting for, and we'll, find out about their audience, what's more important to them, and so that's how we go about choosing which ones are the best.
That's great. And then talk to us about the Cogdell
Center. We did the women's, they had a second annual women's conference is what they called it. And basically what they do is they find different people to come in and present on topics that are important to women's health and to women, especially their students there at the Cogdell Center, which are primarily ESL, GED classes, things of that nature. And so we were able to go in and we did a presentation on jobs in healthcare. Lisa and I did that with some of the ladies from the clinic. And we talked about various types of jobs within a clinic, not just nurse, not just doctor. We talked about the receptionist and the people that do the scheduling. And so we had several people with us there, and they just talked a little bit about their job, and it was just to give somebody outside of a clinic structure an idea of what they could find job-wise within the clinic structure. So it was different.
So so from what you just said, you're trying to look at lots of avenues to go in and pull the community in, get them involved, get them educated in a lot of the new things that are going on, new ways of doing things.
Exactly.
I know Dr. Anderson was here a couple of weeks ago and talked about some of the new findings that they're having through their research that's saying you don't have to have pap smears as often or as early. You don't have to have mammograms as in the same way that you used to. So there's a lot of new trends, and as we learn more and more through research, which is again why we're having this research project that you're involved in, where we have adolescent girls, girls 13 through 21 actually, being involved in this project. And so the fact that you're helping with this, you've got a 3-member team that's overseeing this project. Hasn't this been fun for you?
It has. It has been fun.
And then as you invite these young girls and young adults into this beautiful facility that has been made just for them with these visitation rooms, it makes you, again, very proud that you work for the Texas Tech University Health Science Center.
Yes, ma'am, it sure does. And on the rooms, I came in on the tail end of the rooms, so I didn't have to see or deal with any of the worries about how, this detail, that detail. I was there at the very end when they were putting the finishing touches, so I got to see the end product, and that was exciting for me because it was like, oh, okay, I can just come into work and things are done for me.
but another thing, as a mother, don't you see how important your work is, the trials, this research project, and this facility? Do you have a young daughter?
I have a young son.
A young son. Well, but what's good for the young daughters are good for the young sons.
Yes, and I've learned a lot. And he tells me often, I'm glad I'm not a girl. I'd be in that research project. I said, yeah, probably. But
in a minute, you'd be
in a minute.
it.
But he's trying real hard to get the word out about the Adolescent Care Project because he's heard so much about it. So, you know, he would like to hand out brochures to anyone that will take one.
and so one of the things that we need to say in our last few minutes is, how do people sign up? We need at least 60 people who have never been on any kind of hormonal medication, whether it's for acne or for your birth control or for heavy bleeding or menstrual cramps, any of those reasons that people take the hormonal birth control pills.
Right, and to sign up, really all you need to do is call the clinic. Lisa's direct extension.
The numbers are rolling across your screen, and if you miss them, you can call me. But the important thing is to call the Texas Tech Health Science Center Laura Bush Institute, and they will get you to the right person if you'll just tell them you're interested in Dr. Chupp's research project. And then once they get you, you'll answer any questions. Maybe they're not sure they want to be, but they'd like to ask some questions. And then you'll give them all the answers. Invite them down to look at the facility and then to talk a little bit more about it. And once they sign up, it's very simple at that point, right?
Yes. Once they sign up, and the good thing about this project is they deal directly with Dr. Chupp or with Lisa at all times. So they build that rapport and that, relationship right off the bat there.
And then when they have other problems, then they already know how to see a doctor and what to do.
Right, and with our portal that Lisa spoke about earlier, through that portal they can send messages to Lisa. They're secure, and they can just send like a email message to Lisa asking her any questions that they have, and she checks that all the time, and she can respond back to them in a timely fashion. So they're not having to wait for a call back or anything like that. They can just leave it through the portal. It's secure, and then she'll answer them back from there.
And what's really important is that the parents can be involved in the 13 to 17 and must sign a consent slip. And so any questions from parents would also be welcome on this phone number and our email that's rolling across the screen.
Yes, ma'am.
It has been such a pleasure to have all of these ladies here for the last 2 Sundays talking about this special research project that we'd like for you or your daughters to be involved in. We'll see you next Sunday with another program. Thanks for joining us today.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.